Good day everyone, I'm Catherine Rose Pagangan, BSN 12B, and today I will going to perform the perineal flushing. So, perineal flushing involves the cleaning the private area of a patient, the perineum and genitalia. This is done for the purpose of removing the perineal secretions and odors, prevention of infection and contamination, and to promote the client comfort. Perineal flushing is indicated for the patient who are in the postpartum, who has a perineal repair, for the comatose patients, bedridden patients, and for those who have indwelling catheter. So, prepares all needed materials, washes hands first, of course, to save the time and effort and prevent the spread of any microorganism. And prepared all the necessary equipment needed, and this include the bedpan, the kidney basin, 7 cotton balls soaked in cleansing solution, 7 pieces of dry cotton balls, the sterile forceps, assuming, and these the working gloves, the perineal pad, the pitcher with warm water, and the new sets of clean underwear. Next, explain the treatment to the patient to let the patient understand the procedure and gain the patient's cooperation. So, good morning, ma'am. I'm Catherine Rose Pagrangan, your student nurse for today. May I see your wristband? Please state your name and birthday, please. Okay, thank you. So, today, ma'am, I'll be doing the perineal flushing. So, basically, I'm just going to wash your genital area so that you may feel the more comfortable and refresh. Okay? So, next, screens the patient or locks the door of the patient's room to provide privacy. So, I already closed the door and the curtain so that no one from outside will disturb while doing the assessment. So, next, positions the patient on a dorsal recumbent, puts the patient on bedpan for the patient's comfort. Okay, ma'am, I need to flex your knees and I need you to lift your buttock so that I can place the bedpan underneath. Okay. So, I will help you to lift your buttocks in count of 3. Okay, ma'am? Okay, 1, 2, 3. Okay. After doing that, I'm going to wear my working gloves, then start the cleaning of the perineal area of my patient. Drapes the patient, exposing only the parts to be cleansed. Okay, ma'am, I will expose your genital area. So, next, flush the perineal area with water. Warm water is used to prevent chilling and soften or dissolve the blood clots. Ma'am, I'm going to pour warm water over your perineal area. Okay? So, as I was doing that, I'm expecting also the perineal area of my patient, noting for any particular areas of swelling, inflammation, excessive discharge, suppressions from the orifice, and presence of odors. Next, get the cotton balls soaked in cleansing solution using the pick-up forceps. So, get the cotton balls soaked in a cleansing solution using the pick-up forceps. To maintain the sterility, I'm going to place my kidney basin here. Assuming that this is the kidney basin. This is the where I'm going to discard the use of cotton balls using my sterile pickup forceps. Assuming that also this is a sterile forceps. Then next, cleanses the external genitalia starting from the midline of symphysis pubis down to the anus. Never retrace a stroke to prevent the contamination of the area. So I'm going to clean the genitalia of the patient starting from the midline, from the symphysis pubis down to the anus. So next, with the second cotton balls, clean starting from the mons pubis in the figure of 7 by the way of external libium towards the anus, and discard. Secretion that then collect around the labia minora facilitate bacterial growth. Then discard and pick up another which is I'll be using for labia majora from the farther, and start at the mons pubis down to the anus by way of figure 7. Then do likewise on the opposite side with the next cotton ball to clean the opposite side. Then I'm going to pick up another cotton ball and then use it to clean the labia majora of the opposite side. Next, with the fourth cotton ball, clean starting from the mons pubis in figure of 7 by way of external libium towards the anus, and discard. Secretions that tend to collect around the labia minora facilitate bacterial growth. Then do likewise with the opposite side with the next cotton ball. This is to clean the opposite side and then do the same thing. Okay. With another cotton ball, cleans the groin starting from the groin, going up to the thigh. Use other side of the same cotton balls for the near groin. This is to clean the groin part of the patient. And then, I'm going to pick up another one and clean the groin area of the patient. And then, then discard and do the same on the other side. And then, okay, next, flush the perineum through with sterile warm water to clean the perineum. Okay, ma'am, I'm going to pour again warm water over your perineal area. Using dry cotton balls, dry the perineum with the same stroke as above. Okay, moisture support the growth of many microorganisms. Next, remove the bedpan gently and turn the patient to side to prevent spilling the contaminated water from the bedpan. So, I'm going to lift your buttocks again so that I can take the bedpan. So if necessary, takes one cotton ball and clean the one side of the buttocks, then cleans the other side of the buttocks and dry both buttocks. So to provide comfort, then next turn the patient on her back and make her comfortable. To turn the patient on her back and make her comfortable so that the patient maintain their feeling comfortable while cleaning their butt cheek. Okay, ma'am, can I clean your butt? Spray with the antiseptic as needed so that to promote the healing. Then puts the perineal pad with an up-down motion as needed to prevent a contamination of vagina and urethra from anal area. Next, now I'm going to place the perineal pad on my patient underwear. Perineal pad is absorbs the blood and discharge from the vagina. Okay. Okay, ma'am, we are done doing the procedure, and I hope you feel refreshed and comfortable right now. Okay. Thus, aftercare material used to clean all the material used, sterile, record the treatment done to patient and discharge observed for documentation purposes that procedure was done and means of communication. Okay, and that's all. Thank you.